Thursday, November 27th. I'm Adam Walsh, and this is The Signal. Today on the show, we are talking about diabetes. This province, historically, some of the highest rates in the country. November is National Diabetes Awareness Month, so we've got a bunch of folks to talk to about that. Yeah, and by a bunch of folks, I mean, we're talking, we can get explainers, people treating diabetes, living with it, advocates, people looking at the prevention side of it, you name it. Also, as you're listening, if you have thoughts for us, give us a text, 709-327-8206. You can email us, thesignal@cbc.ca. And as we get going, I'll open up the old phone lines as well. But if you know the number, I mean, you can always just call, and we'll take the call. Joining me here in studio, we've got Dr. Ashley Power. So we'll go 111 and a couple of folks on the phone. So a little intro each. How are you doing?
I am doing great. How are you?
Good. Tell us about yourself.
So my name is Dr. Ashley Power. I am a general internal medicine specialist. I practice here in St. John's. I work in a combination of hospital setting and private-based setting. I do a lot of metabolic and diabetes and obesity medicine here in the province. Otherwise, I am a born and raised Newfoundlander, so you are not going to get anybody more committed to the healthcare and well-being of Newfoundlanders than a Newfoundlander herself. So.
Okay, so did you grow up in town or outside of town?
See, that's the tricky. So my family's all from out around the Bay, so I feel like I have very much a Bay woman vibe, but also I have the benefit of living in town as well, so I have two different perspectives. I grew up in town. Okay.
I grew up at CBS, so the town folk look at me like, you're not part of us. And then my relatives around the Bay are like, definitely not. So I'm just in this no person's land. It's a tough place to be in. All right. Thank you, Dr. Power. We'll go back to you shortly. We have Katie Wadden is here. Small steps for big changes, is it? Yes. Tell us about it. And yourself, too.
Okay.
Because you matter.
Yes, Katie Wadden. I am the Eastern Research Lead for the diabetes prevention program called Small Steps for Big Changes. So this is a national diabetes prevention program. And I am helping to coordinate the three provinces, Newfoundland and Labrador, New Brunswick, and Nova Scotia. And our program runs through the YMCAs.
All right. I've got a lot of questions about that. But first, seeing you said YMCA, I'll go to Colin Corcoran. How you doing?
Good. Yourself?
Good. Tell us a bit about the work you're doing with the YMCA in this program.
Yeah, so I'm the program manager at the YMCA, and I'm the team lead for SSBC at the Chespenny Family Y location. Yeah. So I basically help implement and run the program, get our coaches going, train them on, and boots on the ground type of role.
Cool. And how are things at the YMCA? How was it this morning before you left? Busy?
Yeah, it was definitely a busier day this morning. I guess people are trying to get their workout in, get out of the weather a bit. So it's going great. Yeah, see, I like running, and I looked outside. I'm like, I'm not running today in this. So, yeah, it does. If having a YMCA or some place to go in for working out, pretty good. Joining us on the line, we've got two other folks on the line right now. Mandy Woodland joins us again on the show. Mandy, how you doing?
I'm good. How are you, Adam?
Good. Thanks for doing this. Remind folks, you've been on the show a few times, talking, I believe, about both, it's the tech side of things and also the diabetes side of things. So remind folks who you are.
Yeah. So also from Conception-based South, so not a townie, not a Bay woman.
Oh, you understand me.
I get it. Although I feel like we affiliate much more strongly with Bay, so I don't know. I am a long-time volunteer diabetes educator and advocate in the diabetes space. So since the early 90s, I live with type 2 diabetes myself, and I work in health innovation. So that's been part of my job in one way or another for the past 15 years or so, after working in health law for 10 years before that. And also have a tech startup in diabetes prevention. So that's me.
Thanks for that. I'll come back to you shortly, so sit tight. Angelia Burden is also on the line. Hello.
Hi, so my name is Angelia Burden. I'm actually from Labrador, actually Port au Simpson, Labrador, but I'm living on the West Coast now. I've been living with type 1 diabetes for over 2 decades. As well, I'm the mom of a child with type 1 diabetes, and my husband actually has type 1 diabetes as well. So we bring a strong lived experience of type 1 diabetes.
Excellent. All right. So there's so many questions I have for everyone, but I guess for the explainer bit, I'll go back to Dr. Power.
Sure.
Type 1 diabetes, type 2 diabetes, overall diabetes. Can you just give us a bit of an explainer to kick things off so folks, because I think these are things that people hear all the time, but maybe they don't completely know the differences.
Absolutely. So there are different types of diabetes, and they're classified a little differently depending on on a molecular level versus the phenotype of someone. What we classically think of type 1 diabetes is an autoimmune type of diabetes where people's immune system make components that kind of act against their own pancreas, and they can't secrete or respond to insulin appropriately in an autoimmune kind of way. Oftentimes, this is a diabetes that is diagnosed in childhood, but in certain types of patients, it can be diagnosed later on as well. And those are specific types of autoimmune diabetes. Those patients are generally what we would refer to as insulin dependent, so they can't often avail of other medications to treat their diabetes, like patients with type 2 diabetes can. Type 2 diabetes has historically been called non-insulin dependent diabetes because it acts in a different way. So it's very complex and multifactorial disease, but it has to do with how your body secretes insulin from the pancreas, not in a physiologic way, and your body not also responding to that insulin in a physiologic way, so that you can't respond to what you eat or, store your energy, use your energy in the exact same way as somebody who doesn't have diabetes. So it's a non-autoimmune type, but it's due to a number of genetic, environmental, sociocultural factors that are really complex to try to explain. So these patients can avail of medications that are oral or tablets or pills. They can have injectable medications. They can have insulin to treat their diabetes. But it's important to distinguish, sometimes type 1 versus type 2 versus other types of diabetes. You also get types like gestational diabetes, which is a diabetes that comes along with some of the physiologic changes in pregnancy. So we treat everybody with an individualized approach depending on what kind they have.
When we look at Canada and different provinces and territories, Newfoundland and Labrador always kind of like representing highly with rates.
Correct.
What's the conversation around like why? And I know it's complicated, but like what's some of the conversation around why that is for this province for these higher rates compared to other places?
Specifically for type 1 diabetes, many of those risk factors are linked to genetic or, on a molecular level type basis. So we have a little bit of a founder effect in Newfoundland where we started with a relatively small gene pool, and things like different mutations or different genes can be expressed more predominantly in our population in comparison to other bigger populations with a bigger pool.
So like the Newfoundland curse with the heart issue.
Kind of, yeah.
Because that's the founder bit too.
Yeah, with
genetics.
ARVC, it's a very similar type idea, and because it's autoimmune in nature. The other thing that's interesting about type 1 diabetes, it's linked to minimal UVB exposure because geographically of where we are located. So there is some association with low vitamin D levels with type 1 diabetes as well. When we're talking about type 2 diabetes, that's when you're talking about much more of the sociocultural influences. So type 2 diabetes can be impacted by other modifiable risk factors like someone's diet or their physical activity level, and also has been linked to things like education level or geographic location, all of which are pretty unique to Newfoundland. So we historically have lower levels of physical activity. We are geographically isolated. There are issues with spreading education and resources to some communities. There are issues with food insecurities, for example, that make the prevalence of type 2 diabetes more in Newfoundland and Labrador. And then, of course, we have more patients who are affected and also undiagnosed.
All right. That's a great kickoff to things. Thank you. Mandy, we'll go to you. So we've got, we went definitions, explainer. Now I'm just thinking lived experience, and from diagnosis and how life changes, to also the family element of whether it's support or thoughts around family members. I'm just wondering if you could just kind of continue with a bit of your story on that.
Yeah, happy to. So, for me, I had worked in this space in a research capacity, in a volunteer and tech capacity prior to being diagnosed. I have other family members, including my dad, with type 2 diabetes, so understood it, but obviously not living with it. And so for me, there was a lot of, particularly with existing cultural stigma around type 2 diabetes, and that level of shame of I felt like I should have known better because I worked in this space and somehow been able to prevent it, as well as just like I said, a lot of that stigma around type 2 diabetes and people assuming it's because you ate poorly or because you were out of shape and things like that. So I just felt really poorly about myself with that diagnosis initially. And so for me, that was a really big, I think, like mental and emotional adjustment of being accepting of that as just another part of me, while also doing what I could to ensure I worked really hard to prevent complications and ensure I stay healthy. And the important part of that, like you mentioned, family. So any and all support's important, right? It's important for me that my friends and family are really supportive, that I have an amazing care team, so that I have a great, I'm super fortunate to have a great primary care physician. My pharmacist is wonderful. All those things that are really important for us living with diabetes to take care of ourselves.
Thank you, Mandy. Angelia, what about yourself?
So I was diagnosed more than 2 decades ago. So we're 2002, actually. I was 11 years old at the time, so that's going to date me. So I've been living with diabetes for 21 years. My daughter was diagnosed in June, so June the 14th, 2021. And then my husband, December the 15th, 2022. For me, for the past 2 decades, I mean, I've seen a lot of change, quite a lot of change. When I was first diagnosed, I carried around quite a large glucometer that I used to check my sugars, and I had insulin that I took from a vial with very big syringes, and I injected like that. So it was challenging growing up like that. I must say, I had to stick to a very strict diet. I did play sports, and involved with sports, sometimes I would have to go to the bench if my sugar was low, or those sorts of things, or even skip practices sometimes, that sort of deal. Wasn't able to eat whatever I wanted when I wanted. But I mean, there's been a lot of change in probably the past 10 years, even in the past 5 years. For me, it seems like it took a long time to see change. Others, I know it kind of probably seems a little bit more rapid, but when I look from the beginning to now, and how much easier it is to manage diabetes than it was years ago, I see quite a difference. Historically, I struggled personally myself with my A1C, which is a measurement of your sugars over the past 3 months. So I struggled with that up until about, I guess, 10 years ago, when technology has changed. And now things are much easier. Now I can live, my sugars are like those of somebody who's almost normal, I would say. So quite a big change in the past 23 years. And I'm happy to talk more about that if you would like.
Sure, yeah. Well, here, what we'll do is I'll circle to the other two, and then I'll keep circling back. And Doc, if there's if you want to interject anytime too, feel free. Want to talk about research?
Change, yeah.
Yeah.
We're part of the change, so I'd love to.
Yeah. So tell me more.
Okay. So as I said, I'm the Eastern Research Lead for Small Steps for Big Changes. And we are a national diabetes prevention program. And so this program was developed by Dr. Mary Jung, or PhD, Mary Jung at the University of British Columbia, the Okanagan campus. And Kyle and myself, we just got back from Toronto, so we were there for our annual Small Steps for Big Changes meeting. And today, most of those folks are now at the Diabetes Canada conference.
Right.
And so what our program is it's designed to help adults who are at risk for type 2 diabetes, so what we call pre-diabetes. And the program is developed to make meaningful and sustainable changes, hence small steps for big change, and changes with regards to exercise, diet, and it's done on a personalized level, a one-on-one, and it's delivered currently through YMCAs across Canada. So from the research perspective, I'll just give you a bit of history as to why our program differs. For example, if you were just to kind of show up at a gym and, talk to a personal trainer, it's very different than being told what to do, being told, okay, this is the type of exercise you should do. This is the type of diet that you should prescribe to. So we don't do any of that in our program. Our program is really founded on behavior change frameworks that are evidence-based. So Dr. Mary Jung, she developed this program in 2017, and she tested it on a very small cohort of individuals in a laboratory-controlled setting. And she saw significant changes in health outcomes. So we talked about the A1C levels. So she saw significant decreases in those blood sugar levels. And actually 80% of those individuals stayed or actually went from pre-diabetes to not being in that pre-diabetes category.
Right. So you're pulling people back from a ledge, so to use
exactly.
an example.
Yeah, okay. Exactly. So we're really in that preventative stage of things. But what we know is that a lot of evidence, a lot of research takes a long time to be implemented into clinical practice, and the gap is 17 years is what we typically hear. We can't wait 17 years for prediabetes prevention programs. And so what she did is she engaged in something called implementation science. So she took what was known in the laboratory and she tested it in community. She strategically picked the YMCA because, as Dr. Power talked about, diabetes is not because of willpower. It's not because you ate too much sugar, these kind of things. It's very complex. It's very multifaceted. It's heavily influenced by the social determinants of health. Access. So the YMCA, we know, is a very inclusive environment, and through funding, through federal government, this program is offered for free. So we received, or Dr. Mary Jung received, significant funding from the federal government in 2023, and she was now able to scale that program up across Canada. So in our first year, we launched the Small Steps for Big Changes program at 10 YMCAs across Canada and 8 different provinces. And Kyle and I learned this week that Newfoundland and Labrador is a success story. So we are leading the way in different factors. Recruitment, our coaches have been absolutely phenomenal. So we're getting some of the top ratings from our clients. And we're seeing real significant changes in health outcomes from the clients that engage in the program. And so I remember one of the research assistants from Western Canada, she's like, "What's in the water over there? Like, what are you guys doing?" So it's just, we're really happy to celebrate some positive stats around diabetes in this province.
So then with the outcomes you mentioned there, is that folks who were kind of pre and now not, or what are some of the outcomes you're seeing that are so positive, and with the feedback from folks?
So right now, preliminary data, we're looking at weight loss. So we're seeing, on average, the clients are losing 1.1 kilograms of weight. We're seeing an increase in physical activity engagement to approximately 120 minutes of moderate to vigorous physical activity per week, which is excellent. We're seeing completion rates. So that's a huge thing with behavior change programs, is a lot of times we see dropout. So we talk, people have their goals for the new year and they engage in a bit and then they drop from the program. Whereas we're seeing completion. People are following through with the sessions and staying around. So I think it speaks to the evidence-based nature of it. It speaks to the YMCA, the Chespenny Family YMCA, are extremely competent, passionate people, and they really care about community-based care. And I think this is a big shift that we're seeing in our province, since the Health Accord in 2010, is that we need to start bringing services from hospital to community. And this is a perfect example of doing that, and our province is ready for it.
And that 120-minute bit, right, 2 hours a week, like isn't like that's recommended nationally? Is not for like just for physical activity up to rigorous activity for people individually. And like there was something on the morning show, I think 2 weeks ago with Jen White, and this was the bit. Only like around 51% of Canadians were making it to this mark. So then if you look at a focus thing like you're doing, and you're having all these folks who are making it to that 120-minute mark, I mean, that's fantastic.
Yeah, it's truly amazing. Yeah.
Kyle, now's your time to shine. Tell us what it's like at the YMCA for all this stuff that's happening with the program.
Yeah, so we were really excited to be able to implement SSBC within the Y. So YMCA is very prominent on making an inclusive and open space for everyone to come in. We do that in many ways through stuff like financial assistance programs, so everyone can come and work out, find a place they belong. If it's taking a fitness class, taking a social class that we would have in our buildings. So, with the SSBC program, it was a great adaptation into it. So, like we kind of touched at, when we enter that space and people sign up, they already know that it's an open and safe space for them to come and learn and belong within that. So we've seen a great uptake of people, especially in the last 6 months, coming into the Y. We're seeing more and more people succeed and go through the whole program, and actually referring people, such as friends and family members, into the program.
So, Doc, a question for you now.
Mm-hmm.
If you go from pre-diabetic to diabetic, like what are some of the bad health outcomes? Like what can happen? What are some of the things that can happen to you if this happens for yourself?
Yeah. So the distinction between prediabetes and diabetes is really just a number. It does represent a physiologic or pathophysiologic state. Having prediabetes means that your hemoglobin A1C, which as we mentioned was about your 3-month average of your blood sugar or surrogate marker of that, means it's not quite at the level where you would be considered to be having diabetes. It's prediabetes, meaning that it could be progressive and you are at risk for having diabetes. The cutoff is really just a number between prediabetes and diabetes, like I mentioned, but the risks are really on a spectrum. And it's the risks associated with metabolic diseases that we're talking about as a group. So things like a higher risk of hypertension or high blood pressure, higher risk of dyslipidemia or high cholesterol, obesity or overweight, things like obstructive sleep apnea, fatty liver disease, all of that is on a spectrum, so that the more abnormal your lab values are, for example, or your parameters are, the higher the risk or the more further along that spectrum of diseases you become.
Yeah, so if you remain low risk, there's fewer intersections with the medical system, hopefully.
Correct.
You hopefully can, you can possibly live longer, live healthier, all those types of things.
Absolutely. And diabetes, having a formal diagnosis of diabetes puts you in the category of patients who are at an increased risk of having, for example, less life expectancy by 5 to 15 years, having a higher complication rate of things like cardiovascular disease by 40+%, things like renal failure, amputations. And so that having the formal diagnosis really puts things in perspective a little more in terms of complications, whereas pre-diabetes puts the focus on prevention of not only diabetes, but the complications that go along with that.
So Kyle, how does it feel to be helping folks with that and keeping them in the low risk category? I mean, that's pretty cool.
Yeah, no, it's actually great. And we're getting a lot of positive feedback with that, a lot of great success stories. And, talking to our coaches, talking to people who become members of the Y, and even people when they're doing these SSBC sessions, it's such a rewarding experience. We're running into situations where you talk to someone who wasn't sure if they'd ever be able to revert this, type 2 diabetes, and they're going in and finding out that they can. They're seeing changes. They're able to go on longer walks with their grandchildren, their partners, etc. So it's such a rewarding thing to see happen and see people hit the goals that they're wanting to do.
Did you, when you started working at the Y, did you think that this would be some of the job perks of helping folks? If they're just thinking about I got so there's a nan or a granddad who got to go for a longer walk with their grandkid today, partly because of some of the work I'm doing.
Yeah, so I come from a background of fitness for a while. So, you get some of that with personal training, fitness classes. You've seen people start to get more active, but the health aspect of it is something I didn't expect. So coming in and learning about the SSBC program, getting trained on and helping implement it within our location, it's definitely something that is very rewarding and unique to the program and to the Y. That's, takes it outside the normal realm of someone being able to hit a general fitness goal. You're seeing people's whole lives change through it.
That's amazing. And Katie, what brought you into doing this, right? For Big Changes, to be the Eastern Canada Regional Research Lead. What draw you to it, and how does it? You've touched on it a bit, but how does it feel to hear from Kyle there, the boots on the ground success?
Yeah, I did grad school at UBC, and I always knew, same as Dr. Power, love this province. I always knew I was going to come back, and why I went away to do my PhD was to gain a unique skill set that I could apply back here to improve healthcare at home. So when I got the email to be asked to be a part of this team as an applied health research scientist, I was like, yes, absolutely. I knew the stats here. I know people have been advocating so long for, improved healthcare, improved community care, and I wanted to be a part of this well-oiled machine team. Yeah.
You're listening to The Signal. I'm Adam Walsh. Today, for the full show, we're talking about diabetes. We're getting explainers. We're talking about folks living with diabetes, helping others. We're talking about treating it. We're talking about prevention. You name it. If you have thoughts for us on this topic, you can text us 709-327-8206. You can also call 709-722-7111, 1-800-563-8255. Email us thesignal@cbc.ca. We've got Laura O'Driscoll on the line with the Policy and Advocacy Team for Diabetes Canada. Because often with the show, we like to, start with Newfoundland and Labrador, sometimes even a community, and then also sometimes zoom out to a pan-Canada perspective. Laura, thanks for joining us. How you doing?
I'm doing great, Adam, and I should note that I am also a Newfoundlander and Labradorian. I'm very lucky, although my position is national, and I spend a lot more time outside of the province than I would like. I live in Grand Falls, Windsor. So
right on.
Lucky.
Yeah.
So
I love what we're hitting today with the local crowd. This is awesome.
Yeah, I don't know if it's Bay. I guess we're more woods people there. So
yeah, I think there's So for Grand Falls, Windsor, the Gander crowd as well. I think there's some special categories. Don't send me hate mail, everyone. Let me see. Just when you're with Diabetes Canada, Policy and Advocacy Team, and it's an awareness month, what's some of the messaging that you try to get out there?
Well, I think everything, and sorry, it's a bit loud. I'm currently going to our conference that was mentioned, and so I was just on the train, but it was a little bit delayed to Toronto. But really the focus of Diabetes Awareness Month this month is exactly what the guests have been speaking about, is that, the blame and the shame that comes around with a type 2 diagnosis, but also the misunderstanding of what diabetes is. And I'm so happy that folks from Small Steps from Big Changes are involved. Dr. Mary John's research, we, along with many other groups, provided funding for that. So it's great to see, the conversation around exercise as medicine, but it's not as easy as move more, eat less, because, we know that, exercise and eating better is the first line treatment for, diabetes and many other chronic conditions. But, having an evidence-based approach really shows what can happen and what people can actually achieve when they do have the supports available.
So what are some of the conversations that are happening at this convention you're at up along?
Yeah, so this is is our diabetes conference that we have every year, the Diabetes Canada and the the Canadian Society of Endocrinology and Metabolism. So every year we come together to learn about new research in diabetes care, best practices, hear from healthcare providers across the country, and work together to figure out, okay, well, what's going on in one province, what's going on in another, and what can we all learn from each other to do better to really improve the quality of life for people living with diabetes.
So then for a Newfoundland and Labrador look at things, is there anything that you've either been learning, have learned, know about for pushing things forward in this province for more success that you want to mention?
Yeah, well, I appreciate the chat around the difference between type 1 and type 2 diabetes. And I'd like to just note that in Newfoundland and Labrador, we know that there are over 70,000 people diagnosed with diabetes. The vast majority of that is type 2. About 5 to 10% of cases are type 1. And that doesn't account for the significant proportion of people in Canada, close to 1 million individuals who have undiagnosed diabetes. So really, what we'd want people in Newfoundland and Labrador to know, especially with an aging population, high, rural, remote, and northern population, is to when you do have access to speak to a healthcare provider and get screened. So have your HbA1c, so again, your average sugars over a 3-month period checked, and have the conversation, what we call the ABCDs of diabetes, that, when you talk about your blood pressure, your cholesterol, your diet, your, feet, and mental health, and all of those other comorbidities associated with diabetes, because diabetes, unfortunately, and there's been a lot of conversation about the complications, does not only impact, the body's ability to produce insulin, but also, everything from the eyes, the kidneys, to the heart, and to the feet.
All right. Laura, I'll let you get on with getting to that conference. Thanks for taking time to chat with us.
Thank you, and then thank you for having us be a part of it. And, looking forward to hearing the rest of the conversation.
Awesome. Laura Driscoll, thanks again. That's Laura O'Driscoll there with the policy and advocacy team at Diabetes Canada. I love talking to folks with their stuff in the background, like going through a train station, because I'm just picturing her kind of doing the interview, talking as she's making her way to the conference. It just gives an element of realness to it in Radio Land. We got an email, and then I will to two other guests who've been waiting patiently for me to come back to them, Angelia Burden and Mandy Woodland, who are still on the line. First, I'll read an email, and then I'll go back to them. The email from Yvonne says, "Hi, Adam. I noted the topic of your show today, an issue to consider. We have known for some years that Newfoundland and Labrador has the highest rates of diabetes in Canada. We know that the Health Accord recommended being part of a national pharmacare program, which begs the question why, when the Canada Pharmacare Act was passed in October 2024 and the initial coverage was to be diabetes meds and devices, the then NL Premier, in brackets a doctor, and the then NL Health Minister, John Hogan, weren't out the door to get a national funding agreement in place so that all NL residents could get free coverage with their MCP cards. We know there were later talks, but no urgent push. It also could have been a cost savings on drugs to the Newfoundland and Labrador health budget. I didn't hear that Premier Wakeham raised the issue with the PM yesterday. The current federal budget still has a line for pharmacare, but no dollars attached. Limbo, exclamation point. It is going to be up to premiers of the 7 provinces and 1 territory to push to get equal federal drug coverage for their citizens with BC, Manitoba, Yukon, and PEI. So that's from Yvonne. I'll just put that out there. If anyone wants to kind of chime in on it, feel free. Mandy, I'll go back to you first before Angelia. Just any thoughts on the conversation so far, or do you want to move it to some of the tech side of things and the assistance and what's been happening in recent years?
Yeah, I'll do both. Just a quick point to the email, and obviously I'm not going to speak to political priorities and things like that,
nope,
but I was very happy to attend a regional Atlantic event last year on diabetes, where folks from Newfoundland and Labrador's pediatric oncology team spoke to the access in Newfoundland and Labrador for pediatric diabetes patients to devices and meds and things like that, and how we were leading the country. So there is a positive there. We can always do better, of course, particularly with our population burden of diabetes. So I did want to make that point because I know that team has done amazing work. And I think we don't, as Newfoundlanders and Labradorians, we don't tell our positive stories enough. That doesn't mean we shouldn't be focused on fixing the problems, but I like to also show where we're winning.
Yeah, and multiple things are possible at once. We can be doing good things, need to improve in other areas, and it's all like the reality that we're living in. And I think I agree with you. It's important to talk about all of it, to paint the full picture.
Yeah, and so there's been a couple other points I'll hit on, weave the tech in, and then you can get back to Angelina. But I think for me, hearing all of this is really exciting. Small Steps for a Big Change is an amazing program. In my opinion, the work that Dr. Zhang and Dr. Wan and team are doing is really, really important. And it's important that when we talk about all those things, that we meet people where they are. So me, for example, being in tech and interested in tech, that was really important for me, and what tools were able to help me manage my diabetes, as you've heard me say probably a million times before. So in terms of like tools and resources, Diabetes Canada is great. For me, having a continuous glucose monitor is really important. And Angelina talked about that shift in technology over the past 20 years, and it's been huge. So for me, like, I couldn't function without my my Dexcom G7 device. Like, but for especially as someone who lives alone, being able to share my glucose levels with family and friends so that if something does happen, someone else can see it. Like, I'm so grateful that that's how the tech has advanced. And the other big thing is for me, being kind of a busy, middle-aged working person, like most folks, being able to see my levels in real time. So none of these like finger pricks a million times a day, and being able to see what's coming so I can like prevent a low before it happens allows me just to kind of continue. Like, with anyone with chronic disease, we all have kind of this full-time second job of managing that while still working and trying to like contribute to families and society. And so that piece for me is really, really important. Has totally changed my world. And it's what actually helped me. I know we've talked a bunch about A1C levels, get my A1C to a normal level as well. I use like the air quotes around normal, but like to 5.3. And so as someone living for many years now with type 2 diabetes, that's always my goal, right? Not be a further burden on our overly taxed health system for complications, but also be able to play with my niece and nephew and run circles around the house with them and walk my dog up, currently in Halifax, up Citadel Hill on a daily basis. So yeah, and this month and the awareness is really important to combat some of those misconceptions, continue to spread awareness. And then one of the biggest things for me is also making people aware of the risk so they can get tested and diagnosed earlier, so that if you do have it, at least you can intervene.
All right, thanks for that. Angelia, we'll go back to you. Thoughts on, the different discussions we've had, or do you want to keep drilling into your own family perspective, or both?
Thanks. Thanks, Adam. I'll do a little bit of both. So I left off with those large, painful syringes and large lancing device. The biggest change in the management of diabetes for me was my ability to purchase a continuous glucose monitoring system. I received my first continuous glucose monitoring system when I was pregnant with my second child. My first child was completely finger sticks, but at that time, the technology was still relatively new. When I moved from the insulin syringes, we moved to the insulin pens and then eventually to a standalone insulin pump. But the standalone insulin pump and then the continuous glucose monitor, both of those devices, they didn't work together at that time, but it was very helpful because the CGM would predict the highs and the lows long before I would have even felt them. So giving me the ability to respond quickly and prevent dangerous situations. With this technology, I was able to reach the A1C targets required for pregnancy. When you're pregnant with diabetes, you're expected to maintain glucose levels almost identical to somebody without diabetes. which requires a really restrictive diet, highly structured, and following constant attention. So, achieving that control without severe hypoglycemia can be a challenge. So, for me, the CGM was truly a game changer. Then with Abigail, so Abigail was just 2 years old when she was diagnosed with diabetes. The first signs and symptoms appeared at daycare. She was drinking an unusual amount of water. Her educator said that she had consumed between 2 and 3 of those kid-sized thermoses in a day, which is quite a lot for a 2-year-old, right? At first, I wondered, maybe it was just a hot day. I mean, it was June. Then on our way home, she said, "Mommy, I can't see." First, I thought, well, maybe the sun was in her eyes, but I looked back and she had her sunglasses on. So when we got home, I did check and with the glucometer, and it flashed 23. So I knew then that I knew what was happening. I knew her sugar was high, but I can remember back then thinking, well, this can't be happening, right? So I did a second check, and I knew what was happening. The first year, things were extremely busy and extremely challenging. I had a baby. My husband had just started a new job, and Abigail was now diagnosed with type 1 diabetes. She was started on a Dexcom right away. So I had a Dexcom, she had a Dexcom. Both of us had type 1 diabetes. But without the Dexcom, I mean, she wouldn't have been able to go back to daycare. I wouldn't have been able to go back to work. Eventually, we moved to a new piece of technology that has been available in the last 3 or 4 years, probably. So that's the automated insulin delivery system. So, and this pairs with her sensor to increase or decrease her insulin in real time. And things have been quite amazing. She is now in school. She's in grade 1, and she's doing really well.
Well, I mean, I'm so happy to hear that. Angelia, I am wondering about the roller coaster you kind of described there for everything your family was processing with the health news and everything else that was going on. How did you folks take care of yourselves on the mental health side of things? Like, what was the balancing process? Because I know it must have been an awful lot.
Yeah, so for me, originally with type 1 diabetes, I mean that's challenging. I grew up in a small community. Nobody else had type 1 diabetes. There were neighboring communities with somebody with type 1 diabetes. So really, type 1 diabetes at that point in time wasn't very many people who knew about it. Went on to university, carried around my glucometer in my purse, checking that kind of deal. Wasn't really as attentive as I should have been, I guess. So that was a bit of a roller coaster in a sense. And only really toward the end of university, when technology started to develop, that I started to really, okay, I need to make a change, right? So, and I know a lot of people might be listening and thinking, I might need to make a change too. I felt so much better. I was able to pay attention better to my studies, do better, get better grades, get a university degree. Then when we got Abigail, that year, I mean, after having a baby and being glued to the Dexcom pretty much all the time, seeing what was going on with her sugars, trying to take care of yourself is extremely hard. I do want to say exercise would make a big difference mentally, improving mental health, physical health, and it's really been key. The treatment for type 1 diabetes, which was mentioned, 5 to 10% of everyone with diabetes is insulin. Like there's no other treatment, but it's important, the diet, the physical activity, the sleep, mental well-being, doing things that you love, those things are really important as well.
And Mandy, just what about yourself on that, on the emotional side of it, the toll, or just the roller coaster that it can be, and the mental health side?
Yeah, absolutely. Yeah. And knowing that, no matter how well you do, eventually you probably progress and end up with other complications. And we also know that type 2 diabetics, as well as type 1, and well, all the other types, I'm being exclusionary here, have some of the highest rates of depression as compared to the general population. And so it's really important to have that support, right? Whether it's peer support, professional support, etc. I think that's a really, really key piece to it. I think for folks with type 1 diabetes and managing with insulin particularly, there's so many decisions they have to make in the run of a day. And I've seen some of the stats on it, and it's wild that it's so exhausting. And you don't actually get to take a break from it or step away from it. And I think that's a really important piece to keep raising awareness about.
Thank you. We got another email. It says, on both sides of my family, diabetes can be traced back to my grandparents. Also, my father had it, all type 2. I presently have it. I watch what I eat, walk most days. I've lost weight. It's hard at times, especially when you love a good feed or can't get exercise. And Gary, thank you for that email. As always, Dr. Power and Katie, I saw you both nodding through some of these things. Do you want to expand on the nods? Who wants to go first? Go for it.
I can, I suppose. So starting or having conversations about new technologies sometimes is difficult for the public who maybe don't have an awareness of what the historical data has been. So just for people listening to get a better understanding of that, years ago, before we had the technologies that we have now, patients with diabetes used to have to prick their finger to check their blood sugar multiple times per day.
I remember that with my Nan Walsh growing up.
Yeah,
right?
Sometimes dozens of times a day. And even though that may not sound cumbersome, the reality of that is you have to carry along your diabetic supplies, your glucometer. You have to carry around supplies to treat your blood sugar. You have to then deal with sores on your fingers and things like that.
The stress of always wondering.
And the mental load of always having to make these decisions. And some of the stats are, they show that people living with diabetes have to make over 100 diabetes-related decisions per day. So that's a huge mental load on patients. Now where we are is we've moved from the multiple daily finger pricks to these devices that are basically sensors, usually that people wear on their arm, and they measure not blood sugar directly, but interstitial glucose levels, which are a marker for your blood sugar levels. And so they are updated to your phone or device in real time, so that as you go about your day, you have the ability to look at your phone and look at what your, surrogate for blood sugar or blood glucose level is. And you have the ability to make those decisions more freely and live more freely based on the information that you have. So those technologies, like the continuous glucose monitors, are very freeing for people. They allow us, as well as healthcare professionals, to streamline their care. So instead of somebody coming into my office with a 500-page notebook of their blood sugars that they have collected over the last 3 months, we sit down and have a chat, and then I just take their phone and I look through the app that they have downloaded that stores all of this data, and I can make decisions very quickly about how to treat them, what's working, what's not working, and go from there.
Wow. Yeah, talk about changes in not that long a period
changes.
of time
Yeah.
compared to what it was. Katie, what about PhD researcher? What about yourself? With saw you nodding to anything jump out at you from the conversation, whether it's on the mental health side of it or just with the management of things nowadays?
Yeah, I guess I can't speak exactly to the email, but to me, and echoing is about support and feeling like you don't have to go through this alone. And if you've been told that you have prediabetes or have been diagnosed with type 2 diabetes, is to find help. Behavior change and to make sustained behavior change is extremely, extremely difficult. And you should never feel that that's something that you have to accomplish by yourself. There are, like our program, there are professionals that should be there to help you and support you through those changes. So, that's what I would say on that.
And Kyle Corcoran, at the YMCA, physical activity, you're right in the Department of Mental Health help for folks, right? Because I run, and it helps physically, sure, but it also, I'm pointing at my head now for folks in Radio Land, it helps up here. What's it like for you to be I asked earlier a bit about just in the field of with the program you're working on and helping folks who are perhaps pre-diabetic and pulling back from that, but just in general when you're in that space of knowing that it's mentally helpful and healthy for folks to be working out and at a place like the Y.
Yeah, so a lot of people definitely get, like you said, like this mental high after they went for a run or an exercise, and it's at the Y, we try our best to promote that inclusive environment because we know that, exercising, getting active, being fit can definitely be a barrier for some people.
And some gyms are very intimidating places to walk into if you're not used to pushing the things up in the air like the way the other people do and how they look. So for some complicated language for everyone there. So to have it inclusive is massively important.
Yeah, no, exactly. So we try to really foster that environment where anyone can come in, regardless of your experience level, and get a workout in, feel like you do belong, not have that intimidation factor. And we do that through a variety of our programs, SSBC being one of the ones that is targeted at pre-diabetes, and other in-house ones that are there to introduce people and get more people more comfortable in the gym environment.
This is the part of the show where I ask for final thoughts, and there's 5 of you, so let's keep it to under a minute if we could. Katie, why don't we go with you first?
I was going to say we started off the show with the Townie Bayman type talk, so I'd just like to expand on that our program is not just offered in St. John's.
There we go.
At the Just Penny Family YMCA. Because of our success, we are actually the first province to expand rurally. And so now our program is being offered at YMCAs in Marystown, Placentia, Central Labrador, so Happy Valley Goose Bay, and as well as a new YMCA in Bonavista.
Oh, amazing.
Yeah, so we're expanding our reach.
All right, folks. So if you're in those areas, go check out your local YMCAs if you've got some questions. Go ahead.
As well as family physicians.
And family physicians.
Refer.
And don't forget your family physicians if you have one. Manny Woodland, quick thoughts from you? Final thoughts?
Thank you, Adam, as always, for helping raise awareness about important things for community. And I think I just want to highlight for people, it's really powerful to see more awareness. So many people are affected by this condition. And just know if you feel isolated between the technology and the groups that exist to help you, reach out and try and connect. It's very helpful.
Excellent. Angelia Burden, final thoughts for the day on you. You got about a minute and a bit.
Thank you. So thank you for taking the time to speak with me. I just want to end with words of encouragement. If you're listening and wondering if it can be done, it absolutely can. We have a household of 3 type 1 diabetics who are completely dependent on insulin, and we're doing it every day. Keep the basis of management with you, the exercise, the sleep, the water, mental health, and you can do it too.
I love that message. Kyle, any final thoughts from you?
I think, a lot of people are covering a lot of the stuff they say. Yeah. Just main thing is, if you're worried or concerned about being pre-diabetic or curious at all, just check out the SSBC program and check out the YMCAs in Newfoundland, and we'll do our best to, get you in there and
love it,
help you out.
Cool. Dr. Ashley Power.
So the message that I would leave people with is that diabetes is a very complex chronic disease. Early detection and education is key, and it's key for advocacy. We have some great technologies, some great medications that we have that we didn't have 10 years ago that we can use to treat this complex disease, to prevent complications in the future. And so I think getting the message across that it's not a personal failing, it's not self-inflicted is really important. And please talk to your healthcare provider about ways to go about screening and treating.
All right. And I know it's a final word, but I lied. Katie, just to look ahead, you've talked about expanding. Where do things where do you hope to see things go with the program or just research or prevention, or any other final thoughts on that?
Yeah, I guess I really hope that, we see the community as a place where healthcare can happen. And we're, in order to provide holistic care to all people in this province, we need to be able to use all our resources, whether that's in the hospital, whether that's community, and we need to all work together to do that. So I love our team of people that are here right now because I think we represent that.
Yeah, it's been a fantastic discussion. Typically, when I have 5 people and I say we're wrapping up, everyone goes over on time. But today, everyone was so good on time. I had extra time for this last question. Thanks for coming in for this. I appreciate your insight, your expertise, for all of you. That is it for today's show, everyone. So if you have questions for us, the Signal at cbc.ca. You can call the Signal line and leave a message, 576-5260. We're staying on the health discussion tomorrow, but it's health and nutrition. We'll talk about culturally appropriate food. We'll dig right into a big discussion that will touch people from right across Newfoundland and Labrador in different communities, because food insecurity and food security will come up in this discussion as well. Until tomorrow, thanks for listening. Cheers.